Today, IFF is pleased to announce the release of its latest early childhood education system study titled No Small Thing, Addressing Systemic Inequities in Early Childhood Education. I will be joined today by Hall Family Foundation Program Officer Davin Gordon, Early Start CEO Deidre Anderson, and IFF's Senior Community Data Analyst Nicholas Arjona to present an overview of the report's findings, which is an analysis of the accessibility of the early childhood education system in the Kansas City metropolitan region. Additionally, you will hear from both Davin, who is leading important engagement in this sector in Kansas City, as well as from Deidre, who will share part of her real-time experience working in early childhood in Kansas City. Feel free to drop questions in the Q&A chat along the way, as we have provided time at the end to answer as many questions as possible. My name is Stephen Westbrooks, and I am the Executive Director of IFF Southern Region and lead our 35-year-old organization's work in Kansas City. IFF is a nonprofit and mission-driven community development financial institution that helps communities thrive. Across the Midwest, we work at the nexus of facilities and finance to help nonprofits and other service providers to create safe, inspiring spaces that enable them to achieve their missions and support their communities. We help clients from every sector, including human service agencies, schools, childcare providers, community health centers, housing developers, and grocery stores. We are committed to long-term partnerships with these community-based organizations because we believe they help ensure every person, regardless of their income or zip code, has the opportunity to reach their full potential and to live in vibrant, equitable communities. As part of our mission, IFF conducts independent research for and about the nonprofit sector, helping foundations, government agencies, and nonprofits themselves make better decisions about programs and services, resources, and public policy. Our research projects include needs assessments by service and geography, assessment of organizational capacity for existing or new services, analysis of population and economic trends, data to support strategic planning, and mapping and analysis of program data. IFF's broader research and public policy work grew out of our efforts more than 2 decades ago to understand, invest in, and increase the availability of quality childcare options for families with low incomes across the Midwest. No issue is closer to our hearts or speaks more directly to our mission. Our research helps partners understand the landscape for programs serving children from birth to school age. We measure the supply and demand for each program type, including infant and toddler care, Head Start, early Head Start, and pre-kindergarten. We analyze where the highest need for each of these services is and can work with stakeholders to close the gaps that are identified. In 2019, IFF published the First Steps to Equity study in St. Louis, where we studied and mapped the substantial inequity in accessing quality and affordable early childhood education in that metropolitan region. Our findings and recommendations provided data support to many other efforts to improve the system in St. Louis that has led to increases in local funding, the creation of a central coordinating entity called Gateway Alliance, and other direct action that is improving access to the early childhood education system in St. Louis. Because the Kansas City region shares much of the same context, characteristics, and history as St. Louis, we know that many of the same barriers to accessing affordable and high-quality early childhood education also exist here. Thanks to generous support from the Durwood Foundation and the Hall Family Foundation, as well as significant amounts of time and very keen insights from more than 30 community partners, the greater Kansas City community now has access to rigorous data and analysis that clarifies what the barriers are to accessing early childhood education in the Kansas City region, as well as actionable recommendations on what to do about it. I will now turn it over to IFF Senior Community Data Analyst Nicholas Arjona to discuss IFF's research methodology. Nicholas?
Thank you. As Stephen said earlier, my name is Nicholas Arjona, and I'm a Senior Community Data Analyst with IFF, here to further discuss the data insights methodology that we employed in this study. First, the methodology we utilize is an equity measure called an Access Index that indicates if a community has fair access to early childhood education services based on their needs. The index makes use of a gravity model that is a long-established spatial analysis approach based on Newton's law of gravitational force. As the distance between two locations increases, the attraction between them decreases. When determining the need or demand for early childhood education services within a community, we look at the estimated number of children that require these services. IFF's research methodology includes both qualitative and quantitative portions to not only look at how many services are available and in need, but the quality of the services. We leverage quantitative data from authoritative sources, such as the US Census, ESRI, Child Care Awareness of Missouri, state agencies, and many others. For the qualitative data piece, we gathered information from community members on the early childhood education landscape, and we worked with the Family Conservancy to gather firsthand information from providers in the area through a provider facility survey. Our team developed a methodology that is unique and different from others within the field. We make sure that our research is community-based, involving stakeholders and community members throughout the process. We also believe that our research is actionable, that what we describe in our report can lead to a direct response. And finally, we center our research around equity in all our analysis and discussions from the first action on the project to the last. To ensure that an equitable approach is utilized in our analysis, the Access Index does not constrain household choice. This is accomplished by factoring in access to all providers, not just those within imposed artificial boundaries. Each census tract has an Access Index, which allows for comparisons at a small geography level, as well as the ability to summarize the data at higher levels. Our gap, service level, and access analyses all take a very nuanced approach, looking at particular needs and characteristics of families and the offerings of providers. Rather than saying all families need the same type of care and all providers provide the same programs and services, we break out for families and providers. IFF looks at both provider capacity and family need and provider capacity by program offerings, such as subsidy, Head Start, Early Head Start, and pre-K, and ages served, 0 to 5, 3 to 5, and 0 to 2. We look at how programs, such as state subsidy, are administered and accessed as well. We also look beyond the gap, service level, and access analyses by examining affordability and the lasting impacts of historic segregation policies like the Homeowners Loan Corporation redlining data. And we talk to providers. What are their challenges and their barriers? We do not use a broad brush approach and make sure that the community's feedback is reflected in our analysis. Through our detailed methodology, we strive to ensure that the findings are of the highest quality and integrity. And with that, I'll turn it back over to Stephen.
Thank you, Nicholas. So what does the data show? In many ways, it confirms what we know, that for decades, the early childhood education system has been in crisis in Kansas City. And especially since the start of the COVID-19 pandemic in early 2020, the challenges of the system have only been exacerbated. Through our years-long study, we deepened our understanding of local families who struggle to find and afford childcare, deepened our understanding of confusing and complex childcare subsidy requirements and application processes, and of persistent racial and economic disparities affecting access to high-quality childcare. Our research produced 3 major themes that are explored in depth in our report, which is called No Small Thing. First, women shoulder the burden of caring for our youngest children and the immense challenges faced in finding childcare. In fact, 95% of childcare providers in Kansas City are women. As educators, women have experienced low-wage and stressful job environments that are undervalued and under-resourced. Second, we found that historical racial discrimination and redlining practices continue to affect families and their ability to find accessible and affordable childcare. And third, we found that COVID disproportionately impacted our most vulnerable communities and families as we know to be the case in many other facets of American life. When examined geographically, our study found that more early childhood education programs were lost between 2020 and 2021 in areas near the Kansas and Missouri rivers that are predominantly Black or African American and Latinx. Our analysis further revealed that only about half of the 145,000 children in the region had access to an early childhood education slot in their home county. We found that between early 2020 and late 2021, there was a substantial loss of affordable childcare options in the region. We found that finding quality and affordable childcare is not cheap. In both Kansas and Missouri, the cost of early childhood education care is higher than the average cost of rent. We found the cumbersome and confusing subsidy process often prevents families from applying and providers from participating in vital subsidy resources. And we found that even when families do receive financial assistance, they're still expected to contribute an enormous amount of their income to pay for their share of the cost, which still falls short of covering the true cost of care. Childcare in the Kansas City region and across the country is unaffordable. Applying for programs and assistance is confusing, and the legacy of systemic racism and inequity continues to impact the lives of young children. Yet despite this grim reality, there is hope that strategies can be implemented and actions can be taken in the near term and longer term that can begin to orient the system to access and equity. Based on our analysis and with significant feedback from local stakeholders, we recommend the following. First, near-term strategies. As it relates to the early childhood education workforce in the near term, through pipeline and pathway programming, we must achieve teacher preparedness, fair compensation, and teacher retention. In the near term, we must support the training and professional development of community-based early childhood education professionals through shared opportunities and resources. In the near term, as it relates to affordability, we must evaluate the child care assistance and subsidy programs and resolve areas that create undue burden on families and providers to participate across the bi-state metro area. Additionally, in the near term, we must review the reimbursement rate methodology to align to the true operating costs of childcare programs. In the near term, as it relates to system coordination, we must fully staff and fund a regional convening entity, for example, Partners in Quality, to connect and align around investment and advocacy strategies. In the near term, we must support the consolidation of state services into a single office for early childhood, such as Missouri recently did, to help coordinate services and processes and ease the burden on families and providers. Now to the long term. Over the long term, we recommend achieving fair wages and benefits for providers and professionals by aligning pay scales and benefits with the K-12 system. We recommend improving affordability to increase access by raising the maximum income threshold for child care subsidy to 200% of the federal poverty level. We also recommend funding early childhood education as a public service, assisting providers to remain open and stabilized during times of crisis. We recommend coordinating systems to focus on families by building an integrated early childhood data system that supports real-time data about childcare enrollment and capacity. This means creating shared data definitions and terminology using unique identifiers to link data across organizations and data systems, and establishing data sharing agreements and data governance policies amongst participating organizations. Our research report is called No Small Thing because there's too much at stake for the future of Kansas City to not address this crisis head on. We must and we can act now. Next steps for IFF include engaging with the tireless partners who helped create this body of work to share the analysis in depth and to support the creation of working groups who are positioned to begin the hard work of implementing these vital strategies. I would like to now turn it over to Hall Family Foundation Program Officer Davin Gordon for his remarks. Davin.
Good morning. Thank you, Stephen and everyone at IFF for giving us the opportunity to be a part of this project. As Stephen mentioned, my name is Davin Gordon. I'm a program officer here at the Hall Family Foundation. I do also want to thank all of our partners that contributed to this very important report. Early childhood education is the foundation upon which a child's future success is built. It is during these formative years that children develop essential cognitive, social, and emotional skills that will shape their trajectory in life. Yet we are acutely aware that not all children have equal access to quality early education opportunities that align with the needs of the family, particularly those in under-resourced neighborhoods. As a new father, I have seen the positive impact that my daughter, Paloma, has experienced from being in the early education setting, building her confidence, learning to work well with others, building her vocabulary, and sensory skills, and so much more. Although I will say this morning was a little rough dropping her off, but she's building that resiliency. I also recognize the challenges that many families face around access, availability, affordability, quality, and that providers face regarding teacher retention. The Kansas City Early Education Landscape Study holds the promise of unlocking valuable insights into the challenges faced by both families and providers in accessing and delivering high quality early education, which also holds opportunity to approach the solution differently. Albert Einstein famously quoted, "If I had an hour to solve a problem, I would spend 55 minutes thinking about the problem and 5 minutes thinking about the solution." The point he makes is important, that preparation has great value to problem solving. By understanding the challenges faced by families and providers, we can move forward the final 5 minutes of the hour thinking about how we can come together and design targeted interventions that break down barriers and create a more inclusive early education system, utilizing the data gleaned in this study. Thank you again to everyone that was involved in the study and your unwavering dedication to early childhood education. Together, we can make a lasting difference in the lives of our youngest learners and build a brighter future for our community. We look forward to working alongside our partners and community to increase access to high quality care for all children in the greater Kansas City area. And with that, I have the honor and privilege of welcoming our next speaker. She has been a leading voice in the Kansas City early education community for a very long time and a dear friend of mine. Deidre Anderson serves as CEO of Early Start Schools, a network of early childhood education centers here in Kansas City. With that, I want to hand it over to Deidre Anderson.
Well, good morning. It's always awkward when you're on Zoom and you can't see the participants because I'm a participatory leader. But thank you for this opportunity. I want to thank the IFF team for embarking on this study. There are a few things that I'd say in my tenure in working in early learning that are a bit different, which was this is an engaging process that involved numerous providers and families in a more meaningful way than I've seen with some of the other times that we've tried to articulate this problem. As I am framing my conversation with you today, my challenge I'm going to start with and not end with is that this become more than a research study and a report, and that it turns into actionable change, not only in the Kansas City community, but throughout the state, and maybe could be a model for our nation. Early Start had the pleasure and the opportunity to expand just prior to the pandemic. And we've added 2 early childhood centers and we gave birth, as I said, to 2 new schools in a 13-month period of time. And so even as I participated in this study, so much has changed in our organization's life. We unfortunately are among the statistics now, and we have had the misfortune of needing to consolidate one of our centers with our Metro Center location with St. Mark Center for this year to come, because we are a case study example of what is actually happening in real time every day with early childhood providers that are forced with the very challenging decision of how do we serve all the children and families that are knocking on our door every day, but we don't have the workforce that is adequately trained and prepared and equipped and compensated in such a way that they want to remain in this field. I do believe and assert that there are many that would enter this field if they knew how rewarding it might be, but if we as a community could figure out how we could be more innovative and creative in the way that we address the wage gaps that were described. That is the ultimate root of all of everything that's happening in the early childhood field. And we've known that for a while. The pandemic just really shed a light on that in a totally different way. But I think that I don't want to leave us with the doom and gloom and overwhelming nature of the areas that were what I would say brought to light in a very simplified way of saying, if we had a better coordinated system and if we were working in a coordinated fashion to address the workforce, and then if we were also thinking more creatively about an investment strategy and approach that could be made while we have the attention of people that aren't in this field. Everybody is impacted by this issue. It's the undergirding of everything that you see going on in the traditional workforce. And now is the time that we need to seize this moment and not just have a conversation, but move toward action. And a couple of things that I believe are opportunities for us. We are grateful to the governor of Missouri for really taking on this issue more publicly than I've seen in my time in early learning. And we hopefully will be celebrating next month as an executive order is signed that increases pre-K funding and access, but that's a beginning. The funding is not sufficient to fund an entire classroom. And also there will be limitations and challenges for many providers in being able to access that funding. The other is that the state subsidy program in our state is underfunded and is a very out of date model that needs to be overhauled, and we need to think of that as a contract based versus a attendance-based reimbursement, which for us as a provider is like, I'm entering into this agreement on a maybe I'm going to get paid. And that's not how we staff our classrooms. And so we staff our classrooms as if all children are there every day, and that's our hope and desire, but they get sick and their parents need them to stay home. And so I think IFF, no, this is no small thing. And while it may feel like an elephant, how do you eat an elephant? One bite at a time. So let's roll up our sleeves and eat this elephant and make this no small thing something that's greater, so the littlest learners in our community can feel that they are being cared for in the way that they should.
Thank you so much, Deidre, and thank you so much, Davin. And thank you all for joining us today. That's the end of our remarks, and we will now switch gears and open the virtual floor to questions.
Good morning, everyone. So we have two questions that came in that are along the same line and a really good way to start. Thank you for this information. This is a lot of data. So what do we do now? What's a main takeaway that you'd like to leave behind?
Yeah, that's a really great question, and thank you for that question. Nicholas touched on it in his remarks, and Deidre touched on it in her remarks as well. Our research and this research and this body of research is intended to be actionable. I mentioned a similar study that we published in St. Louis in 2019. I was very impressed at the tailwinds that study seemed to create that led to local funding in the city of St. Louis through a ballot initiative that unlocked $2 million additional dollars for providers in the city of St. Louis. It also led to and helped support the creation of a central coordination entity, and Deidre spoke very eloquently about systems coordination, and that was another result of the study that we published in St. Louis. And so the hope here and our intention and our follow-on actions following today is to facilitate a handoff to community partners in Kansas City who are vested in this challenge, who we can work with together to start to eat the elephant, as Deidre stated.
If I could build on some of what Stephen said, part of what he discussed in Kansas City, and I saw Hallie French's question about regional coordination. I think it's been as the co-chair of Partners in Quality, and I have been for several years, it's been in what I'd say a need for a reimagined governance structure and a more formalized structure. And so I think we have a really great opportunity to look at the past, see the present, and envision the future of how Partners in Quality could have a rebirth and maybe be either put to rest or just reimagined totally different, that allows for stronger business civic leader engagements, where we are actually identifying really key policy and advocacy priorities that and funding priorities that would allow us to then move toward the change that we want to see. Also, adding a real dollar amount. When we say there's 145,000 children in our region, only 50% of them are currently being cared for, there's an easy way for us to put a figure to that, and then be able to say, okay, now how are we going to raise the money and where do we start? I think that's part of why no one ever leans fully into this issue, because they don't know where to start.
Thank you. Our next question, is there an entity that exists currently that could play a lead role in a regional strategy for ECE, or would this need to be created?
I believe I kind of said it. I believe it needs to be created. I mean, I think we could crosswalk the various coordination entities and convening entities that exist. What are the strengths? What are the limitations? And what are the opportunities for us to better coordinate? I think we're stepping on one another's toes sometimes, because when you don't see things that are going on, then you go create it and you don't realize it already exists. And so making a list of the various things that do exist in the Kansas City community, and then strengthening them, and then also looking at some other cities that have seized that opportunity a little bit better than maybe we have in Kansas City.
And building
the only thing I would add to that is one of the values I think that this report brings to bear is that a lot of those entities that have leaned into this issue and maybe serve as coordinating parts of the system definitely contribute to the creation of this project. And so I'm hopeful that, you know, re-engaging with those partners and creating something more sustainable that can address the challenges of coordination that Deidre spoke to is quite possible, because a lot of those voices are already at the table.
Building off of that question a little bit, somebody asks, during the presentation, the topic of regional coordination was raised, and one resource listed was Partners in Quality. What is the work of Partners in Quality at this time?
Since I'm the co-chair, I'll say really more than anything right now, it's information sharing. There is a bit of work that's done to look at pending legislation and policy on both sides of the state line. But I wouldn't say Partners in Quality has a coordinated approach to how it is actually taking those policy actions in with a clear pathway toward mobilizing a broader base of people to do something about those things. So in our one-offs as organizations, I'm sure we're doing that work, but not necessarily under the Partners in Quality. And I think, you know, that is probably a symptom of there not necessarily being devoted staff and resources and a clear plan of action.
A question, maybe pivoting to Nicholas from IFF's research team. How did your study accommodate for marginalized communities that are often undercounted in traditional data collection measures, like the census, or not counted at all? Were the access needs of these communities captured?
Yes, thank you. That's a great question. And we readily recognize that a lot of these methodologies do a lot of times undercount for these communities. So in order to make this issue smaller, we try to utilize multiple data sources. So I mentioned ESRI, also provides data on population that we utilize. And something that we also lean pretty heavily on is our local community members. You know, what are they hearing? What are they seeing? What are the populations that are most impacted? So in situations like that, we try to minimize, the limitations that are with certain data sources by comprising our research with as many data sources that are reliable, good quality, and also stress that our data is still an estimate. And we readily recognize that, and we try to emphasize that in our report and our methodology documentation as well.
Thank you. Again, building off some of the roles that other folks in the community can have in addressing these challenges, what do you see as the role of the corporate community of Kansas City? How can corporate parental leave, employer provided care, or other strategies positively impact this problem? And then sort of as a second part, how do you see other sectors, government, other philanthropy, nonprofits coming together to take this report forward?
That's a very good question. And I'd like to, I would frame it as follows. This report is the facts in a lot of ways. We presented a lot of data, a lot of rigorous data. What this report it includes some suggested strategies and recommended strategies. What this report doesn't have is all the answers. I definitely think there is a role because of the large nature of this challenge for the corporate community. The workforce challenge is not solely confined to the provider environment in terms of those specific challenges. When providers close and folks can't get to work, that creates challenges for large employers in Kansas City. So there is certainly a role for the corporate community to help mitigate and potentially solve this challenge. In terms of other key stakeholders like government and other nonprofits, again, this body of work is intended to provide support that can be data support that can be leveraged for action to be taken. And we don't have the answers in terms of what that action looks like. We want to set the table and recreate spaces and help bring stakeholders together who may have some answers or part of an answer that can work together to help mitigate this huge challenge and potentially solve this problem for the benefit of more children in Kansas City. And I don't know, Deidre, if you have something to add to that, just given your proximity to this challenge.
Yeah, I do. I actually spoke to the Education Committee of the Civic Council last week, kind of, current state of the landscape and just, a bit of an update. And as the Civic Council and the Chamber have both been very vocal in being in support of addressing this issue. And we definitely thank them for the support they provided when the pre-K tax was pending. But we fumbled the ball a bit when the tax did not pass, and we didn't keep a coordinated body of people together saying, okay, that failed, now what? So what? And so my call to action for them was to lean in more deeply with this business civic leaders roundtable and discussion with priorities that are established that lead toward the actionable change that's needed, whatever that necessarily would be. I also think it's framing what corporate engagement does not look like. What you don't want to do is, I've heard and been drawn into entirely too many conversations about corporate sponsored childcare. So I'm not saying that doesn't work, but I will say that if we as experts in early childhood haven't been able to completely figure this out, I'm not so sure that corporate, sometimes it's a naive entry into a business that is not in line with their same business. And many corporations that have closed childcare centers because of the complexity of operations. So being able to have them go towards someplace to learn and really look at the feasibility of that, or partnering with other places. In the short term, I think a good place for corporate and everyone is to lean in a more deep way in helping us figure out the supports that are needed to rebuild the early childhood workforce. One thing that has worked in the Head Start arena and with funding from the state has been quarterly retention opportunities for funding for our existing staff, which ultimately turns into what I would call a wage supplement or a wage enhancement. How do we turn that into something that's more permanent, that allows us to not say that Missouri's average wage for somebody working in this field is $12.50, but that allows us to have the floor be a $15 to $17 an hour wage, and that we have some dedicated revenue that is there in support of that. So that would probably be something more along the lines of like a community fund that philanthropy, business, individuals could contribute to until we have a permanent policy solution in the funding realm.
That's a great segue to our next question, which is asking specifically about the funding and if the study identifies the funds needed to meet the best practice goals, including conquering the defined barriers.
I couldn't really hear that question. Can you repeat it?
The question is asking if in the study, if we identify the funds that are needed to be able to meet the best practice goals and to conquer some of the challenges identified.
I'll give a very general response, and then I definitely will kick it back to Deidre, who is our resident expert here. But what the study does identify is that the true cost of care is wildly underfunded. And so that has implications across all the expenses and costs to care for the children of Kansas City. And while there could be multiple strategies to help fill that gap, this report didn't identify what all those potential funding sources could be. I think that's still that's TBD, and that's going to be dependent upon the partners who come to the table with ideas on how to best meet the true cost of care. But Deidre, I know you probably have some really good insights in terms of what that is and what that could be.
Yeah, I think that falls under your kind of call to action and priority around the systems coordination and the data sharing agreements and opportunities. We have a really fragmented data system that makes it real convoluted to get at. I think we can identify, we've identified the children that need to be served really easily, but what we haven't done is, because there are so many children are learning every day somewhere, the question is where and how are they learning? And so when you have family child care homes, when you have licensed exempt providers, school-based programs, community-based programs, church programs, not everybody's registering into the same system. And so that makes it a real challenge in having a well-coordinated system. But just like when children enter kindergarten and they get an identifying number, that then allows school districts to know, or the state to know, when a child's kind of fallen off the rolls because they're not enrolled anywhere. We don't have anything like that for children under the age of 5. And so being able to figure out, and it sounds so strange saying we want an identifying number on children, but it really does go a long way in beginning to sort of create this umbrella data system of types. We had a failed attempt, or I don't want to say failed, an attempt at doing that using the identifying number in K-12. I don't remember exactly what all happened, but part of this, I'm a former K-12 administrator, so I feel like I can say this because I love my K-12 peers, but I'll also say that we have to really dump, and this is going to sound real cheesy, but we have to take collective ownership of our children and stop fighting over who gets what, where do dollars sit, and begin to say, we have 145,000 children, of which only 50% are being cared for. How are we going to own that 145,000 children in our region will end up getting the quality care that they need so they're adequately prepared for the next leg of their journey? And ultimately also see this as, it's not the cost of care we should be thinking about, it's the return on the investment and the benefit that would be provided And we don't need another study to tell us that. There's about a $7 to $10 higher return on an investment at this age versus special education rates, dropout prevention programs, incarceration rates. It's been studied over and over again. We don't need to study that again. We know that already. I'm not sure if I answered the question. It's not an easy question to answer.
Yeah, thank you. So that covers all of our questions. So before we close out, I'd just like to invite all of our panelists, if there's anything, any parting thoughts you'd like to share with the attendees.
I just want to say before we wrap, thank you for your time today. Thank you for your questions, and would love to potentially partner with you if you have a role and you're a stakeholder in this ecosystem. We would love to connect and discuss these findings more deeply with you, and hopefully create strategies that can help us start to mitigate this crisis.
I talked a lot, but one thing that wasn't talked about at all is health and safety and well-being of children is essential. This is not a field where we can go backwards on the strides we've made in ensuring the health and safety of children is cared for. IFF has a longstanding history of working in the facilities space, and we need to continue to be sure that children are in the highest quality learning environments and that we are not adjusting the adult-child ratios because we think that's a solution to our problem. That is going to have us, that's going to cause us to go backwards as a community and a state if we would do things like that. So just thanks everybody that tuned in today.
I would just like to add that I think it's really critical that we continue to find ways to provide leaders like Deidre and so many others in our community the time and the brain space to be able to continue to drive our community forward when it comes to early education. So I think that's a critical role that philanthropy can continue to play, is providing her the opportunity to get out and shine a light, be that megaphone speaking to the opportunities that we have to really solidify the future of our community. So thank you everybody for all your work on this project. And it's just a start.